Hi folks, my name is Dr. Brad Linick, and my goal in this presentation is not to sell you on chiropractic, nor is it to sell you on chiropractic care in this office. My goal is to separate fact from myth, to explain what traditional chiropractors have to offer in the way of care, and provide some insight as to what I do in my practice. Because most doctors in this area are traditional chiropractors, I think a great starting place would be to find what is considered traditional chiropractic care. In short, traditional chiropractic does the following: decreases muscular spasm, increases range of motion, reduces pain. This is what most chiropractors offer in the way of care, and I have no doubt that they all do a great job of accomplishing those goals. Here at Willis ChiroMed, what we do is different. We focus on the structural correction of the spine, which not only accomplishes the goals of traditional chiropractic, but we take things a step further by permanently correcting structural shifts in the spine that can cause a variety of complications. To understand what we do and how what we do is different, let's first start off by talking about what is considered normal structure and what is abnormal structure. Normal structure, from the side, is with your head positioned over the top of your body so that the hole in your ear is directly lined up with the center of your shoulder, your hips, your knees, and your ankles. In addition, from the side, you should have 3 curves in your spine, one in your neck, one in your mid-back, and one in your lower back. Looking at your structure from the front, your ears, shoulders, hips, and knees should all be level. In addition, the bridge of your nose should be directly in line with the notch in the base of your neck, as well as your belly button. At first, minor abnormal shifts of areas of the spine are nothing to worry about. No one has absolutely 100% perfect structural alignment. However, no different than normal body temperature, normal weight, and normal blood pressure, there is a range of what's acceptable and what's unacceptable. If your structural shifts are outside of what is considered normal, then you experience one or more of what we refer to as secondary conditions or symptoms. The reason we call these symptoms secondary conditions is because they result of a primary condition or underlying cause. Picture it like a wheel with spokes. The center of the wheel is the starting point, and each spoke comes off of this starting point. So, the primary condition is the center, and all of the secondary conditions are the result of that problem. So let's look at an example of abnormal structure. As I mentioned, normal structure from the side is with your head positioned over the top of your body so that the hole in your ear is directly lined up with the center of your shoulder, your hips, your knees, and your ankles. Let's say a structural shift occurs that causes your head to move forward from this position to an abnormal position. This shift is referred to as anterior head syndrome. So it's like this. Your head weighs as much as a bowling ball. If you held that bowling ball up against your body, that's normal. Now shift it forward away from your body. Can you see how that can cause fatigue, maybe tightness, stiffness? Now, as I mentioned, no one is perfect. However, if your head is as little as 10 millimeters or 10 degrees beyond what is considered acceptable, you have anterior head syndrome. Your head shifting forward is no different than your car being forced out of alignment or the foundation of your house sinking on one side by just a couple of inches. Because the underlying structure has been shifted, regardless of the reasons, this deviation of your skull puts abnormal stress and tension on your muscles, tendons, ligaments, spinal bones, and discs. You may have guessed the problem is a structural shift, but in this case, of the foundation of your house. Traditional doctors, regardless of what area of healthcare in which they fall, look at correcting the secondary conditions rather than focusing on the underlying cause. The traditional doctor would put an extra nail or two into your floor to stop it from creaking, would patch up your drywall, and put a little WD-40 around the window to help things move a little smoother. Will all of that fix the problem? What would you do if this was your house? That's right. You get out of the house for a short time and let someone who focuses on repairing structural problems come to your house and fix the foundation. After that, and a little work on the secondary effects from the shift in the foundation, and you're good to go. Or what if your child's teeth were protruding from his or her mouth? What would you do? Well, you'd probably be investing in a nice relationship with an orthodontist. Why? Your child's teeth are in an abnormal position, and as a result, besides the cosmetic disadvantages, are not going to function as they should. Over time, if left untreated, The abnormal alignment of the teeth will likely lead to other problems such as chewing problems, jaw pain, the potential for gum issues, and other orthodontic related problems. Now, there are 5 signs that are inarguable indicators of a primary condition. These indicators are not related to age or genetics. They are a result of shifts that have disrupted the normal function of the spine. They include discs that have become flattened or pancaked, damage to the edges of the spinal bones like bone spurs, changes in the curves of the spine, such as with a loss of curve, uneven weight distribution of the body, and any tilts, shifts, rotations, or translations of the body. The first part of a structural examination involves taking a full spine set of x-rays. Just like you wouldn't purchase a house without first looking inside, we don't believe in working on your spine until we actually know what your spine looks like. It doesn't matter if you're an orthopedic surgeon, a neurosurgeon, or any other healthcare professional. What we see on the x-ray is what it is. The x-rays are where we are looking for the first 3 signs. The second part of our examination utilizes digital photography to perform a digitized structural analysis. Here we are looking for shifts in your structure, such as with anterior head syndrome, as well as checking for structural imbalances that cause uneven weight bearing and abnormal wear and tear on your body, such as translations or rotations. Now, just like there is more than one way to cook an egg, there are a variety of ways to treat secondary conditions. Take back pain. More often than not, the first step for most people is prescription medication. If that doesn't work out, the next step is usually physical therapy, where they will have you exercise in an attempt to strengthen weak muscles. Cortisone shots, where they inject steroids into your joints to take down any swelling. And in many cases, when those other treatments don't work, more invasive procedures. My goal is not to give you my opinion about those treatments. The point of this presentation is to educate you on what your choices are so that you are able to make the best decision for you and your condition. As I mentioned at the beginning of this presentation, I focus on structural correction of the spine. I do this by first using a precise measurement analysis called objective synchronous testing. This measurement determines which bones have shifted away from their normal position and whether or not the spinal cord has become elongated. These shifts are considered the primary shifts that have caused your structure to break down. Then, through a series of treatments or adjustments, we restore the proper leverage to your structure by correcting the tension on the meninges and then correcting the position of the primary shifts. What this does over time is cause your body to untwist any secondary shifts that have developed. It also alleviates any associated secondary conditions. So, with the example of anterior head syndrome, after the underlying structural shifts have been corrected, your head is pulled back and correctly repositioned over the top of your body, and your shoulders are held back into their natural position. This takes the tension off of your spinal cord, and your symptoms are relieved. So, after our examination, if I find that you have a structural problem, I'll recommend a plan of care that is specifically designed to address your condition.